In this video, I am going to focus on one connective tissue that is so important for ankle mobility. Today's connective tissue is called retinaculum. What is retinaculum? Basically, retinaculum covers ankle like this. It's on medial part, anterior part, and lateral part. So it basically covers all the aspect of ankle like this. It's not ligament, it's like a wrapping like a connective tissue. Why is this important? Thing is, beneath this retinaculum, many muscles and many tendons pass beneath retinaculum. So that means when retinaculum gets tight, that inhibits movement of ankle, don't you think? Because there are muscles passing here. Let's say if medial part gets tight, this tightness inhibits movement of muscles passing beneath here. Now, what kind of muscles, what kind of tissues going beneath retinaculum? Let me explain from medial aspect. Again, there's a retinaculum right here. It's like this. It's like ankle taping. So basically, three muscles. One thing is flexor hallucis longus, flexor digitorum longus, and tibialis posterior. Oh my gosh, they are so complicated, so confusing, right? Basically, three muscles. They are important for ankle mobility and toe mobility. Think about their name. Flexor hallucis longus, flexor digitorum longus. They are related to toe movement, and tibialis posterior. That is important for ankle movement. Then let's go to anterior aspect. It covers like this. I want to explain three muscles. One muscle is tibialis anterior. Okay, tibialis anterior. I was just talking about tibialis posterior. Now it's tibialis anterior. Now, extensor hallucis longus, extensor digitorum longus. Okay, three muscles on anterior part. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. They are basically important for dorsiflexion, pointing up toes like this way, plus extension of big toe and extension of toes. Okay, let's go to lateral part. Two muscles, fibrillaris longus and fibrillaris brevis. They are important for eversion, like ankle goes outward. Okay. So, if retinaculum gets tight, what's going to happen for ankle movement? Think about it. For medial part, they are basically for plantar flexion and toe flexion movement. When medial part gets tight, opposite movement is restricted. What is opposite from plantar flexion? That's dorsiflexion. What is opposite from toe flexion? That's toe extension. These movements are restricted. Let's go to anterior aspect. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. They basically do dorsiflexion. What is opposite from dorsiflexion? That's plantar flexion. This movement is restricted. What is opposite from toe extension? Toe flexion is restricted. Okay, simple, right? Let's go to lateral part. Fibrillaris longus, fibrillaris brevis. They do plantar flexion and eversion. Thus, dorsiflexion and inversion are restricted. So that's why I focus on retinaculum for doing myofascial release for tight ankle movement. It's very important place. And I want to give you one precaution for doing manual therapy around here. There's one nervous tissue running on medial part. It's like running around medial malleolus. Medial malleolus is right here. This nervous tissue is called tibial nerve. So, when you do manual therapy here, whatever you do, myofascial release, shiatsu, massage, acupuncture, any kind of a physical modality, and if your patient complains there's numbness and pain while you're working here, most likely you are pushing tibial nerve. You want to avoid that. So this is one precaution to do manual therapy around medial part. Besides that, they are so important. Retinaculum is very important for ankle movement. If you liked today's video, please hit the like button, comment and subscribe. See you next video.